Okay, so you found that you had varicocele. So what is varicocele? Varicocele is a condition that is quite unfortunately frequent. It can affect adolescents and also young men. It is caused by a reflux or dysfunctioning of the vein that drains the blood from the testicle. So I have made a detailed video about this subject. If you click on the link above, you can see it. And today the purpose we're going to be discussing the effect of sclerotherapy. Fortunately, we have a very efficient, very simple, non-surgical technique that can help you. So how does it manifest? When you have the blood stagnating around the testicle, it can create a whole range of symptoms, ranging from pain, inflammation, discomfort, sensation of heat. You definitely can feel that something is not normal, or sometimes when it happens early, it can cause testicle to not grow normally. It's called testicular atrophy, where the testicles get smaller, and unfortunately may affect even the ability to have babies. It's called infertility, and it affects young men when they get married and try to conceive a baby. This is one of the causes of primary infertility in men. And it may cause a whole range of problems: low sperm count, low motility of those sperm cells, and motivate patient to go seek help. Traditionally, the treatment of choice, or the most frequently suggested treatment, remains surgery. But for those of you who are interested by another type of treatment, other than traditional cutting and stitches and opening and general anesthesia, there's a interventional radiology treatment that offers a not only a valid alternative, but in my opinion, and in my personal opinion, it's far superior. So today we specifically talk about sclerotherapy. What is sclerotherapy? Sclerotherapy using a foam and an agent called sclerosing agent to get rid of veins. It's used in the lower extremity veins with great success. So basically, the sclerosing agent, once it enters a blood vessel, and in this case veins, it causes them to shrink and disappear. This is very simple, and all you need is a needle stick and the local anesthesia. So that's the power of this technique. It does not involve the classical surgery. It is done under the guidance of imaging, and this is the fundamental principle of interventional radiology. Everything is guided by imaging, and in this case we use another technique called fluoroscopy and venography. So here we see another type of foam that is running inside the vessel. It causes destruction of the inner lining of the vein, and causing it to immediately get inflamed and shrink and shut down. So there's no more problem, there's no reflux. This is how we form and we make the foam. The foam is mixed to the adequate consistency until we can see like a foam. Sometimes we use it as a liquid, sometimes as a foam, mixed to the right, of course, consistency. And I cannot emphasize enough that this has to be done by someone who's experimented in these procedures. The specialists are called interventional radiologists. They are specially trained, long years of training to manipulate all these kind of embolic agents, whether it is foam, sclerotherapy, or glue. Glue is another technique and another alternative to coil embolization, and we're going to see it towards the end of this clip, and it's also very useful. Here, once the sclerosing agent enters the vein, it causes it to get inflamed and shrink, and the result is, that's the advantage of sclerotherapy. The result is very fast. Sometimes you literally can see the result as you inject, and you see those veins disappearing. The other fundamental advantage of this technique is that the sclerosing agent can easily travel along the tributary vein, the collateral veins, those parallel veins that run that it's impossible for the surgeon to see. And since it's like a foam, it will enter whatever it finds an opening and a vein, and it will also treat those collateral vein. And that's what explains the lower risk of recurrence in during this type of treatment when we compare it to classical surgical ligation. The other advantage of this, of course, since we treat only the vein, there's no risk for the arteries, for the lymphatic. You can see here how the vein shrinks, and it literally disappears immediately as we inject. Again, it's just another way to show you here using a sclerotherapy agent called polydacanol that has also been used in treating varicocele. It is mixed by the doctor to the appropriate consistency, and then it will be injected directly using a small tube inserted inside the veins, or the spermatic vein or the gonadal veins. And this is how the physician will mix and obtain the foam with low risk of recurrence, low risk of complications, and a very fast recovery. This is the foam. We test it, of course, before injecting it to make sure that it's ready for use. The next technique that we are going to discuss is another embolic agent called glue. So glue is literally, like its name implies, just like a glue, but it's a medical type of glue that we inject to close and shut down the vessels. Again, it requires special expertise. It's not widely used in these type of condition. It's mainly used in other conditions that we use them in embolize, especially arteriovenous malformation. Again, the glue also can be used, the same principle, same catheters and microcatheters that are entering and selectively catheterizing the spermatic vein. Once the physician is inside the gonadal vein, he needs to make sure that he's in a good, inadequate position. The glue here is called the cyanoacrylate, or an NBCA glue. And the advantage of glue is like its immediate closure, and not only that, but it can also treat those little veins that run parallel to the main gonadal vein and can occlude them very efficiently with low risks of recurrence. The advantage of glue is its immediate effect. Here the physician injects contrast, so we do a venography. You can see a lot of collaterals, huge vein, huge spermatic vein, small tiny veins parallel to it, and reflux of contrast all the way to the testicle. This patient must have a big reflux and varicocele. Then a microcatheter is inserted. Once the glue is prepared, the interventionalist will estimate the location and the amount to inject. Here they compress the vein to avoid any glue to go down all the way to the testicle. We do that also with the foam. And once they're ready, they will carefully deliver and inject the glue, and it will have the immediate effect to stop and close the vein. Here this is just the preparation of the catheter, and now the cyanoacrylate glue is ready to be injected. Everything is done, as you can see, through the catheters and sheet inserted in the patient's vein in the groin. And here the glue is mixed to the appropriate consistency, and it will be injected under live fluoroscopy, so always done slowly. And the glue, this is the glue getting injected, and the interventionist pull out the catheter quickly, and that's it. It's super fast, but again, it needs an experienced operator. It cannot be done with someone who does not have the experience, as it may cause problems or side effects, as if anything. So we discussed the foam sclerotherapy as well as the other technique called glue embolization, which are alternatives or variant techniques of embolization other than coil embolization, which remains the classical technique. foam sclerotherapy has been proven to be very, very efficient with low complication rate and high clinical success rate and high patient satisfaction. Thank you for your attention and staying with me till the end of this video. If you have any questions, don't hesitate, please leave a comment or question. If you like the video, don't hesitate to hit that like button, because those who don't like it, they definitely hit the unlike button, and this will help this video and help it get to more patients. Again, check out the other videos about the topic, and if you have any idea about another topic you want me to treat, please let me know in the comment section. Thank you very much.